So thank you again, Dr. Linda Rudolph. Next we have Will Dominie with Bar High.
All right, thank you. So it's always a little daunting to follow Linda. I'm going to try to kind of keep some of the urgency that she left us with, and then start moving into, okay, great. So what are some of the solutions that we can be talking about, particularly at the intersection of public health and energy efficiency? And it struck me on the way here that this is kind of like a very apropos moment to be having this conversation. So Kellen, you asked earlier, who watched the Warriors game last night? Okay, a couple of people. Who instead or in addition was pressed up against a fan or an air conditioner, right? Okay. Whose house is actually weatherized or set up for high heat events like last night? All right, so we've got a couple of people. I know in the county that I live in, about a third of people actually have air conditioning, and I bet that there's similar rates around weatherization, and in general, homes that actually would like keep us safe during that kind of heat event. I also noticed yesterday how high the ozone and particulate matter levels were, which is another thing I'm going to get to in this presentation, as we think about what are some of the strategies that we can be applying at the intersection of public health and energy efficiency to really try to keep ourselves and the people we work with safe and healthy. So Bar High is, who's heard of Bar High? Okay, great. Okay, awesome. Well, I'll do just a quick description. Someone recently said that Bar High is kind of like the Bahrain of public health departments. I think it's apt. We're the coalition of public health departments across the region. And we have a very specific focus on health equity. And we were founded to try to address the differences that we see by race, by class, by neighborhood, et cetera. And I'll get a little bit more into that in a second. But we cover the 9-county Bay Area as well as the county of Santa Cruz, and then the city of Berkeley also has their own public health department. And we were founded because the issues that actually are shaping residents' health in all of our counties are bigger than any one county could really address. They're bigger both because as people who live in the Bay Area, we actually, we don't like live and work and play just in one place, right? We actually move throughout the region. And then also they're bigger than any one county can address because they actually are going to take a lot of energy, of power, of coordination to really move. So this is the Bar High framework, and this is how we think about the conditions that shape health. So traditionally, public health has really focused, I'm going to try this pointer thing. So traditionally, health and public health has really focused on the right side of this. So thinking about, are people smoking? Are we going to the doctor enough? Are we, following healthy behaviors? Super important. What Bar High, and I think a lot of the public health departments in the Bay Area have really been instrumental in, is saying, yes, that's really important, and it's not enough. And if we're going to be really addressing most of the health conditions down, especially the health inequities that we see, we need to be thinking about living conditions, so things like housing or land use or transportation. Linda already mentioned a lot of these. And then more than that, we need to be thinking about social inequities and institutional inequities. So how are the ways that particularly government and also the private sector and other actors, how have we actually driven and participated in making decisions that have structured a society where there's dramatic differences in health outcomes? And we can see those differences. For instance, this is how Bar High often thinks about the Bay Area. This is life expectancy by census tract, by neighborhood. And you can see there's a 25-year difference by neighborhood. Like, let that sink in for a second. 25 years, that's the difference between seeing your grandchild grow up, right? Like, that's not okay. And Bar High was founded to try to address that. Like, we're trying to make sure that we actually all have really good health outcomes. Another way to look at this is California data. This is by race. And what do you see here? Anyone? I'll just wait. Yeah, so they're going down. What else do you see? There's still a difference, right? So we're doing better over time. This is data from, thank you, Michael. This is data, that starts in the early 2000s. And what we're seeing is, yes, there's generally a good trend. but that there's still incredibly dramatic differences by race. And this is for death rates. So another thing we know, and this Linda already pointed out, but that climate change is really exacerbating this situation. So we have a host of climate impacts, which then drive a host of health impacts, which again she covered in detail, and that those impact some populations and some sets of people much more intensely. We know some of that's medical vulnerability, so elderly folks, children. Some of it's exposure, so like farm workers or outdoor workers. And then some of it is socioeconomic or where you live. So low-income residents, communities of color have tended to really bear the brunt globally and in this country of climate impacts. So I'm going to shift gears just a little bit and move towards housing and health, because we really want to zero in here on how these things play out in housing and health. And this is a diagram from the Robert Wood Johnson Foundation, and I think it provides kind of a helpful schematic of thinking about the ways in which our housing impacts our health. So we have, first off, conditions within the home, right? This is the most obvious, and I think the easiest connection for probably many of you working in energy efficiency. I heard folks from Healthy Homes programs, from asthma programs. Lead certainly has been talked about a lot recently. Then we have neighborhood conditions, so the conditions around the home. And then beyond that, we have housing stability and affordability, and whether we can actually, stay in our homes and afford our homes. And let's kind of put this a different way and dive in on energy efficiency. So when we start talking about conditions within the home, we can think about falls and injury, indoor air, moisture and mold. These are some of the ways that our homes actually impact our health. And these are things that energy efficiency programs, if partnered right with public health, can really start to address. Oops, wrong way. Similarly, neighborhood conditions, we have the conditions that surround the home. So think about noise, for instance, homes near freeways, temperature, again, this is a big one today and yesterday, and then outdoor air quality. And then finally, we get to the outermost ring, housing costs, displacement, and jobs. And I'm going to kind of go through each of these rings to highlight some of the ways that energy efficiency and public health can be thinking about them. And I'm doing just like the high-level scan. In a minute, we'll have a panel to really dive into some of those solutions. Okay, so I want to contend that there's a couple kind of key roles for public health in this. One is we can help target investments. To a certain extent, that's by neighborhood, using some of the epidemiological data that we have to figure out where are the places that we really need to be focusing energy efficiency improvements. It can also look at the individual household level of really finding medically vulnerable households where our energy efficiency investments are going to have the biggest bang for the buck. Second, we can help with outreach. We're in clients' homes every day. We're trusted spokespeople. We have a lot of relationships with the community and also have a role historically in helping to build power and build capacity in communities. So I think we're often seen as a very trusted messenger and someone that's actually day-to-day working with people in their homes. And then third, and potentially most importantly, we can help think about equity, think about how we maximize bringing multiple benefits that Linda talked about, and also avoiding harm. So again, I'm going to kind of like use these lenses to then think about a couple different approaches that have been applied in the past. So one, this is looking back at a health impact assessment that San Francisco did, I think, more than 10 years ago now. And San Francisco folks, you might have to help me on this one a little bit. But what they did is they looked at where energy efficiency resources and upgrades had been used in San Francisco. And then they compared that to where the biggest needs in terms of like air risk, outdoor air quality. And what do you notice? So the green are energy efficiency improvements, and then the yellow and red are places with less good air quality. Can you say that louder? They don't match up. Right. And what they found is that actually if we were able to pull them into alignment, it could completely address the differences in health in the health outcomes that they were studying, which were primarily cardiovascular. And actually, San Francisco folks, do you know where this has gone since this study? Yeah. Oh, okay. Could be worth finding out. I looked briefly and I couldn't figure out like what's happened with it, but I thought it was still a useful example. Okay, another example. So this, the Contra Costa folks are going to talk about more in a second, but I just wanted to briefly highlight, this is an example of the like, let's use data to really target places that we know could benefit the most from our investment. So this is a study I actually helped out with Michael and others in Contra Costa County, looking at vulnerability and trying to identify like what are the neighborhoods where we really want to sink in investments, energy efficiency and otherwise, where they'll have benefits around heat and helping keep people safe. So I'll leave the details of that to Michael. Another example is around habitability. And this is just like conditions in our home. This is a slide from the Healthy Places Index, which is a great tool put out by our sister organization in Southern California, where you can really dive into a lot of health indicators. And I would really suggest taking a look at it when you're thinking about trying to address public health issues and health equity issues, because it can help you really target where you're intervening and what neighborhoods. And so this is Vallejo up in Solano County. And we've been doing a lot of work with the public health department there to think about how are we, as housing prices rise across the region, how are we making sure that we're preserving the affordability of the homes that exist there? Vallejo rents are increasing very steeply, but they're still much lower than in most parts of the region. At the same time, as you can see here in the blue, a lot of the homes don't necessarily have the kind of habitability conditions that we'd like. And another way of looking at this is code enforcement complaints. So this is something the public health department put together for me, where you can really see where are the places where they're receiving a lot of code enforcement complaints, where there's probably homes that could use some upgrades. And for us, and working with the Solano County Public Health Department, we see a real need to, as I mentioned, try to preserve the affordability of homes in Vallejo, and doing that in conjunction with planners, with the healthcare sector, trying to bring in health dollars. And I think energy efficiency has a real role to play here, where we don't want to just like keep homes affordable. We want to keep them affordable and healthy, right? And energy efficiency has, I think, could be and is beginning to be a real source of dollars and energy that can be applied to make homes more efficient and also healthier at the same time. So again, this is an opportunity to really be targeting in Vallejo, but just as an example of around the region, places where we know habitability conditions could be improved while also maximizing affordability. And we know that is absolutely key right now. We know that we are in a crisis in the Bay Area, a housing crisis, and it's a very solvable one, just to be clear. We know that currently homes that can comfortably afford their housing spend more on childcare, a third more on healthy food, and 5 times much on healthcare, right? 5 times more. And that's a place that if we get energy efficiency improvements in the right households, in the right hands, we can be leading to that kind of outcome where people actually have the kind of money that they need to afford the things that they need to be healthy. This is just another look at the housing crisis. So we started looking a number of years ago actually into displacement trends around the region. And we were wondering, like, is this a thing that's just happening in a couple neighborhoods? Or is it really like a much wider trend? And what we found looking at data from UC Berkeley is that it's a wider trend. About half the neighborhoods in the Bay Area are currently at risk of displacement or already seeing displacement, right? So this is something that's affecting, and it's in all of our counties. It's not just the urban counties, it's literally across the region. We've also seen evictions across the state. This is a Contra Costa specific example. But between 2014 and 2016, there was as many evictions formally filed and many more probably not formally as would fill the Concord Pavilion, right? All of those seats there. evictions in that county. And so I think what that means is that as energy efficiency folks, you need to be, or as public health and energy efficiency folks, we need to be thinking about how are we simultaneously improving the conditions in people's homes and making sure that they can stay in them. And so I wanted to make two pitches here. One, AB 1232, which is legislation that's in the State House now, which actually imposes some affordability requirements for multi-unit apartments that have utilized the LIWIP program. So this is an example of, and I would urge you to think about supporting this specific piece of legislation, but also things like this, where are we making energy efficiency improvements, and then making sure that particularly when we're doing that in rental housing, people can actually stay in their homes. And then similarly, I think there actually needs to be some conversation about the role of energy efficiency and public health folks in actually making sure that tenants have the kind of protections they need so when we're making improvements that they can stay. And that's an easier conversation to have when we're talking about home ownership. But for renters, it can get real tenuous. The last thing I wanted to point out is just another co-benefit, so another place that we can really maximize benefits is thinking about job training. So this is a slide from Richmond Build, where they're training residents in solar installations and energy efficiency, et cetera. But I think we should be thinking wherever we can about how are we thinking about both the sort of intended outcomes of energy efficiency programs, so weatherized homes or energy efficient homes, and then also like what are the benefits that we can generate along the way, like who are we training and bringing into jobs, and specifically, are we doing good outreach and training programs to pull people into this kind of career pathway, make sure they have what they need to be successful in it. The last thing I would mention is just what Kellen mentioned already, the Healthy and Resilient Homes Leadership Program. And this is to your question around sectors and silos, and how separated we often are. At Bar High, we're trying to take that head on and really start a program where we're cross-training energy efficiency folks, resilience folks, planners, and public health people in the skills and knowledge and relationships that we would need and that we do need to really address housing and health conditions. So this, my participation here today, to a certain extent, is like a part of that for me. And we invited all our health departments that are part of that program to come today. And starting in August, we'll be inviting planners and energy efficiency folks as well. So if that's something you're interested in, please come talk to me. It'll be some training in kind of the intersection of these issues. And then also some actual work together on projects that address them. So with that, I think I'm going to stop and make time for questions. Thanks, everybody.
I guess mine's more of a comment, but I really appreciate your presentation, and I think that I'm with Alameda County Public Health, and right now we're actually working with City Council to create a proactive rental inspection program. We got about $500,000 from the tobacco money to use to work with City Council and to create a program where we're actually having code enforcement go out and regularly inspect these apartments. I'm in clients' homes every single day, and I see anything from bed bugs to roach-infested apartments to serious mold issues. And we've actually worked with code enforcement too, because back in, even 5 years ago, when someone would call and say, I have mold, they'd literally just hang up on you. They wouldn't even, that's not a code violation. And so we had to train them what to say when they called for those issues. So I think, if we could, we're trying to use Oakland as an example, working with their code enforcement specifically, and kind of branch it out to other cities and other counties as a way to really help to make these homes more habitable. And I think that your presentation stresses how important that is, because looking at our map of Alameda County, you can see specifically where we have higher rates of asthma, and it's because they're in East and West Oakland. And that's just where these diseases, chronic diseases, are showing up in higher rates.
Right, and probably both because of outdoor air quality and also indoor air quality. And I'm curious, like, have you connected with energy efficiency programs or staff or resources at all yet?
We work with RAMP. I don't know if you know RAMP, but we work with them a lot. So they do a lot of the policy work, and so we kind of help in any way we can. You know, I've spoken in front of City Council, presenting on cases so they could see just how important it is that they do certain things. But yeah, I think that that's something that we're not focused on as much as we probably should be.
And I bet some of the folks in the room today would have some suggestions about doing that. Other thoughts or questions? Yeah, over here.
Hi there. Yeah, so I'm from the city of Emeryville. I'm working on their electrification plan, but centering through gender and racial equity. So I've noticed a lot of the inequities have been focused on the community base, on what's happening in the community, but there's a large equity gap of what's happening of our internal policies of hiring equity and other those sources of components. So I wonder, is there any policies that you have or can might have encountered to make sure that the energy efficiency field is racially and genderly inclusive to not just provide them with the social impacts, but with the environmental justice and economic impact of alleviating energy poverty themselves through employment?
So, I work in government, and so and most of my focus is on government agencies, so that's where I can talk most specifically. I'm less clear in some of the other programs, but I would just like shout out on the government side, at least the Government Alliance on Race and Equity, which explicitly does that kind of both training and then helping local government agencies think about racial equity within their programs, and then also within their HR practices and hiring. I would say within the public health field, we're thinking a lot about that, and a lot of our public health departments are trying to very explicitly create kind of like pipelines for folks that might not think about public health as a career or might not normally have like great career options, frankly, in terms of opportunities to get a well-paying job with the stability of a government job. So we're thinking about a lot that within public health, and certainly happy to share kind of some of the lessons on it. I don't know as much within the energy efficiency field, but I agree with you. I think that's a really important part of it, right? Like just changing the faces of who's in the room doesn't completely transform what the programs do, but it certainly does sometimes change kind of the kind of ideas that are at the table and who's in leadership and what that might mean for the future of the field. So very, very important. Yeah.
Hi. Thank you for your presentation. I think you connected the dots really well. And I just had more of like a comment, thought, reaction. You had a map of the households that had, in San Francisco, of the households that had energy efficiency upgrades and like how it doesn't compare. Yeah, that one. And I know there was like the question over whether there was a follow-up to this. Someone said no, and then everyone started laughing, which to me I felt very frustrated, and my reaction felt kind of, yeah, just because like these are people's lives and there's no follow-up study, and it's just kind of like a thing that we can just pass on and like not think about again. It's just really frustrating when, you know, it's very clear, like, okay, this is what's happening, but what are we going to do about it kind of thing? You know, these aren't just maps and slides that we can look at, go to a little workshop and then leave. So that was just kind of a thought that came up for me, is like, we're all in this space, taking in this information, but what can we do about it? What are we going to do about it? And just being accountable to what we're taking in and this knowledge that we're receiving, I think is important.
Yeah, and I want to point out and emphasize two parts of what you said. One, yes, like absolutely we need to be thinking, and like this is a call, I meant this as a call with some urgency, right? Like these are people's lives. This is our health. As Linda pointed out, these are situations that are life and death for many, many people. And also, I just want to say, like, San Francisco actually has taken some very proactive steps to think about the kind of development that is around freeways and how we can be improving filtration, improving building standards. So I don't want to leave the conclusion of this slide as, and then they did nothing, because San Francisco's taken some very proactive steps. And I'm not like very involved in those, so I'm sure there's more that could have been done. But I do just want to like say they've actually been a real leader in thinking about how we improve indoor air quality in homes. But that does not take away from your main point that this is like absolutely urgent and we need to be treating it as such. Okay, one here, then over here, then over here, and then over here.
I'm in Alameda County, and I can tell you from working at energy programs in Alameda County.
Could you use the mic?
Oh, I'm sorry. I'm going to say that result was baked in the design of the program. It just didn't happen. I'm not saying people did that maliciously, but the designs of the program were targeting early adopters. And who are the early adopters? So again, when you're designing a program, you need to think about what the potential outcomes are, as opposed to saying we did a study, because I could have told you that 10 years ago.
Mm-hmm. Yeah. So I'm sorry, I've forgotten who I called on. Was it over here?
Hi. To your point, are you connected with the existing buildings office at the California Energy Commission? We're doing a number of statewide programs.
No.
Okay, I'd like to introduce you
Great.
to the new manager there. I think there's a lot of overlap. This is an excellent slide. Thank you.
Wendy?
I do work in the city of San Francisco, and I think the Department of Public Health, who's not here today, could probably answer to what's happened since. But I do want to say, especially since there's a lot of diverse folks in the room, that this also reflects a mismatch between the funding sources, how funding is allocated for home improvement, and the need. And until we solve that, we cannot solve this map.
Right.
And that is beyond local government. It requires all of us at the state and regional scale and local governments to work together to really change that, which I believe our state is working towards. So I am appreciative and hopeful.
Definitely. Okay.
I think your comment really captures a lot of what I wanted to say. I'm just always struck when I speak with contractors or financiers in particular about how they talk about, from the energy efficiency perspective, it's very difficult to get anyone to be excited about an energy efficiency upgrade, particularly as a homeowner. You get people excited about putting in a new kitchen. You get people excited about making some other upgrade, and there are these sort of residual energy efficiency effects that you're able to get people interested in. We don't really talk about, at least in our context, what are the pure or specifically public health related effects of those upgrades. But again, I think it's not just a question of early adopters. It's like, who's putting in a new, very high efficiency hood over their range, right? It's not going to be tenants for the most part. So I think in terms of program design, there certainly needs to be just a rethink of how do you incentivize at a much larger scale and kind of in the aggregate these types of changes, because you're not going to get it if you're just, I'm putting in a new granite surface in my kitchen, and by the way, I'll do this other upgrade that you're going to throw in because I've got this incentive that I don't really understand, but it sounds good.
And I think that's a great point. And just on the health side, I would say you will definitely find people who are desperately looking to improve, their children's asthma or their exposure to lead. Like, those are things that people feel very, very deeply, and they should. The health of our families, like that is a great entry point. And if we can actually make the program connections, the structural connections that folks have been talking about, then we can actually go into people's homes and say, hey, we're going to do this suite of services for you. Your kid will be healthier. You'll save your energy bills. That I think is a much more compelling argument often. Okay. I know you've been wanting to talk for a while over here.
Hi. So yeah, we've been talking about this map for a while, and I think it's sort of been touched upon. But looking at this, most of those dots are probably where there are single-family homes. And while you can certainly do energy upgrades in multifamily buildings, because probably some of those single-family homes are also rented, but it's just that idea again of like control and who's in the building and who's going to do it, and it's a lot easier perhaps to even if you're renting your single family home, to make those upgrades versus in a multi-unit apartment building. And we all know about the split incentive issue where that building owner, might not see those savings. The tenant's the one who might pay for energy. So that's another big issue that we need to look at when it comes to health, obviously, because that's what this map really says to me, is that we're not getting to multifamily properties.
Definitely. So I'm getting the time signal at the back, so I want to close. I did just want to thank Bayren for inviting myself and Barhai, and then also just the public health departments of the room here, and for partnering in thinking about these kind of issues together and trying to design strategies really at this intersection. And then just do a last plug for the Healthy and Resilient Homes Leadership Program. Who's already in the program in the room? Woo-hoo. Okay, so please come and talk to them, and especially me if you're interested in that. And with that, I will close. Thanks, everybody.